Hi, this is a Scribe training video to explain how to do a few types of diagnoses. I'm going to start with routine care note within a test patient. Okay, so I'm first going to just share my screen here, and I have a test patient opened up right here. So this is a AMI test. So the main areas we're going to focus on are the physical exam, how to document routine visits, different procedures, and then assessment and plans. So we'll start with physical exam. With physical exam, the best template that I like is under the saved templates. And it can either be a diabetic foot exam, which is a CDFE, or it can also be a routine care normal. What this does is this pulls in the normal values. And initially, we have to document something called class findings. So if the patient has an amputation, we have to document that on which foot. That'll make this type of nail care covered. Then we have to do class findings, and specifically, it's going to be circulatory. So circulation, is it absent the dorsalis pedis and posterior tibial? If they're absent, then we would have to put those in there. There's class A findings, B findings, and C findings, and we would put those in there. Now, one thing you have to realize is that the class findings have to match the cardiovascular. So, for example, if you put in there that there is an absent pulse, then you're also going to put in here that there's an absent pulse right here. So the dorsalis pedis and posterior tibial. Very rarely do I use this diminished. I really don't use it. I use either they're absent or they're palpable, or they might be Dopplerable. If you would put Dopplerable, you would put that in here, writing in the pulses are Dopplerable. Sometimes we use the Doppler in the office. Also, with a routine patient, you might put in edema. And then integument, this is the main place that we look for these routine patients. If they have any macerations or dampness in the web space, you can put in there. If there's scaling, if there's macerations, if there's any odor in there due to that, any signs of infection. Sometimes there can be a bacterial infection or a fungal infection. Next would be onto the skin, specifically possibly on the plantar aspect of the foot. You might have some tinea pedis or athlete's foot. You don't tend to write tinea pedis in the physical exam section. You're going to write like a dry vesicular bullous lesions on the bottom of the foot, or pustular lesions, or scaling on the plantar foot. And then in the assessment and plan, that's where you're going to put in tinea pedis. For calluses, you put in where the calluses are. So specifically, there's a couple of types of callus we do. Let's say the calluses are present on the first and fifth med head. They could be a lot of other places. If they're painful, if it's a porokeratoma, which is that callus with a really deep core, you're going to put a central core and it's painful. If there's bleeding underneath it, you're going to put hemorrhagic. And if there is some maceration or the beginning of an ulcer, you're going to put maceration under it. And then what I do is I copy this and then I paste this into the procedure documentation later on. I'll show you how to do that. So that's what you're going to do. Keratomas. Then going down to nails. For nails, if they are thickened, I put in which nails. So let's say the same thing. It's the first and fifth nails that are thickened. I'll put the one. And normally what I do is I do all of these down to pain to palpation. It has to have pain to palpation for it to be covered. And then if there's any blood underneath the nail, I might specify which ones have blood. So if it's hemorrhagic under the great toenail or something like that, that's how I would document that. And once again, remembering which ones you put in, because that'll affect it in the procedure. Also, if there's an incurvated toenail, you could put medial border of what toenail you would put in. And to change which toenail, you would just double click and you would put in like the hallux or the second toenail or things like that. This proximal clearing noted of thickened toenails is usually used for someone that's coming back after taking Lamisil or terbinafine. Okay, so that's that one. Okay, if there's any signs of infection as well. Neurological is usually, we're looking at two things specifically. We're going to be looking at the Sims-Weinstein and the vibration. So vibration is that little tuning fork that we put on their toe, if it's detected or not detected. And then Sims-Weinstein, if they have inability to detect, you can put what locations they can't feel it. So it might be, for example, on like the first met head, like they can't feel it there. And then if they have any paresthesia, like anesthesia, things like that, to indicate neuropathy. Then down into musculoskeletal, you can put in any bony abnormalities. We'll talk about this later, but most commonly what we put in here is there's bunion, which is hallux valgus, or Taylor's bunion, right there, and then which hammer toes they might have. Within hammer toes, they come as flexible, semi-rigid, or rigid, and depending on what type of deformity you're seeing. So when you put that into the note, this is the physical exam portion of the note for routine care. And if you're doing a diabetic foot exam, you can also add another saved finding or a template for something called a CDFE. It just has a little bit more information in that type of a note. So that is the physical exam portion. Then you're going to go down to the procedure codes. With this, I have some groups already set up. So one's called like a nail care. I'm sorry, this is procedures. So within procedures, the most common procedures we do are for keratomas. So keratomas are either 1, 2 to 4, or 5 to plus. Keratoma is the same thing as a callus. So I would do that one. And then as I mentioned before, on the right side, and I copied and pasted, I'm going to put in which ones we did. So if it was the right, first, and fifth med head, the same thing from the physical exam I put in here. That's under the calluses as well for nails. It's going to be a debridement of nails. So it's usually 1 to 5 if there's less than 5 nails, and then 6 to 10 if there's more than 6 nails. So the one that I put in there, it was the right, first, and fifth. Those were the ones I debrided. And then the other ones I usually put in there under trimming of toenails. So you have to pick the other ones that are there. So all the other ones you would pick through as being trimmed. So that's how you would do nail debridement and then trimming depending on what it is. Now, if there's 6 to 5 or 6 to 10, you wouldn't have to put in any of this. So those are the more common things that I use. Sometimes with routine care, I'm going to do a porokeratoma, which is a really deep one. I'm not doing this every 3 months. That's just not the way to do it. It's going to be, but if it's like once a year or every so often, I use a lesion destruction code, which is this one right here. This is the same thing that I'll use occasionally for a wart, but it's a lesion destruction code on a very deep callus that's deep inside called a porokeratoma. So that would be the diagnosis that I would use. Those are the most common diagnoses that we're going to use in a routine care note. Occasionally, if they have an ulcer, we'll use like an ulcer debridement as well. Like if it's a debridement of an ulcer, there's going to be a skin tissue debridement code that could be used as well for that patient. So those are the procedure codes. And then the procedure codes, they need to match with the assessment and plan. So assessment and plan, what we have here is, I think it's under nail care. It's under routine. So when you hit routine, it's going to actually pull in foot callus, ingrown toenail, foot pain, and then onychomycosis. Then also you're going to pull in if they have diabetes. You could pull in a diabetes type of a template. There is a diabetic with a diabetic shoe referral as well, but for diabetes, you're going to pick type 2 diabetes for the most part, and then you can pick by clicking this what type of complication if they have anything. So mostly our patients have like a polyneuropathy, so you could pick diabetes with polyneuropathy or any other type of diabetes. So this is the typical one that we use for our patients. A lot of our patients as well have poor circulation. So I have a PVD I put on here. And along with PVD, there's an ABI, which is the ankle brachial index that's going to pop up as well. Going to be in order for ABI. This is something that'll pop up when the patient checks out. It'll kind of cause our staff to make that ankle brachial index appointment. That's going to be done here in the office. Another thing you might want to do with diabetics would be a diabetic shoe. So you can type in diabetic shoe referral, okay, or heat molded custom insoles. So there's different ways of doing this, but this is going to be a diabetic shoe referral. And once again, you have to have diabetes and some type of a diagnosis. And I'll move this up here. For diabetic shoe referral, it has to go under the right diagnosis here. And then you have to send it out to proper location. Currently, there's not many places around that we're doing this for our patients, but Bouvier is the most common one that we're going to be sending this to. So that's going to pull in that referral. So this is the most common type of note that we're doing for routine care patients in the office. And then when you get down to the plan and then the discussion, so this is going to be the diabetic shoe one. And then you're going to get into the discussion. So there's a couple of discussions that we have here. One is just nail care post CDFE. There's a lot of different ones. So here's the nail care one that I do. This is just the nail care when they come in. You could also do a keratoma. There's some keratoma templates as well for trimming the keratoma. And there's also another one called porokeratoma, which is another one for that if there's a really deep lesion in there. And then if we do diabetic shoes, there's other one for diabetic shoes, and you can put in what's the risk factor that they have. If they have a foot deformity like a bunion or hammer toe, that would be for the diabetic shoes. And then there's also one for ABIs due to poor circulation. So all these are templates that you can pull in for a typical routine note, and then the patients will come back and schedule that follow-up. So I hope that explains a little bit about this.